Hello, I'm John Sanders, Director of the Benefit Coordinators. We serve you, employees of the federal government. TBC is an educator of your benefits and a tool to your financial goals. Today, we are diving into the intricacies of the Federal Employee Health Benefit Program. It's a critical aspect of healthcare for our federal workers and their families. So if you're ready to unravel the complexities of this program, you've come to the right place. So let's get started. The FEHB handbook by the Office of Personnel Management is a treasure trove of information if you're kind of a geek that likes to read. But let's face it, it can be a bit dense. That's why in this video series, we're going to break it down into bite-sized chunks that make it easier for you to understand your health coverage. So we'll start with the basics. First things first, let's talk about the history. Absolutely, the history of the FEHB program is not just a mere timeline. It represents significant milestone in the realm of the public sector employee benefits. Established in 1960, the program was a groundbreaking initiative designed to provide federal employees and their families with comprehensive health insurance coverage. This marked a pivotal moment in the government's effort to prioritize the well-being of its workforce and their loved ones. Over the years, the FEHB program has evolved to become a cornerstone of support for federal employees. It offers a safety net for their health care needs. However, it is important to note that while the program extends coverage to a large portion of federal workers, certain government positions are exempt from participating in the program due to specific legal constraints. So now let's delve into the heart of what makes the FEHB so exceptional. One of its most remarkable aspects is the cost-sharing arrangement. It's a testament to the government's commitment to the welfare of its employees. For the majority of the federal workers covered under FEHB, the financial burden is significantly alleviated. These employees are only required to contribute a modest 25% of the premium cost, leaving the 75% to be covered by the federal government. This equitable distribution of cost underscores the government's dedication to ensuring that its workforce can access comprehensive health care without enduring an overwhelming financial strain. This strategic cost-sharing structure not only empowers federal employees by making health care more affordable, but also demonstrates the government's recognition of the invaluable contributions made by its workforce. By shouldering a substantial portion of the financial responsibility, the federal government reaffirms its commitment to fostering a healthy and secure environment for its employees and their families. Here's where it gets a little interesting. The FEHB program offers a whopping 200 plus health plans. It offers a whole bunch depending upon what state, territory, blah, 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 even portions of the state. So these plans can be divided into two main categories: health maintenance organizations, or HMOs, and the national health plans. Health maintenance organizations, HMOs, plans, they serve as an excellent options for employees who reside or work within defined geographical areas, as these plans emphasize the convenience of localized healthcare services. By fostering a network of healthcare providers within the designated geographical locations, HMOs ensure that participants have easy access to coordinated and comprehensive care. With the strategic emphasis on preventative care and wellness management, HMO plans often require participants to select a primary care physician who serves as the central point of contact for all healthcare related needs. This structured approach enables the PCP to oversee and coordinate the participant's healthcare journey, ensuring that all medical needs are effectively addressed. Furthermore, HMOs commonly promote a more streamlined healthcare experience by necessitating referrals for specific consultations. This process ensures that participants receive appropriate care from specializing physicians while maintaining continuity with their primary care physician. So if you're someone who prefers a more structured approach to healthcare, this actually might be a right fit for you. Now on to the national health plans. They provide a broader spectrum of flexibility, catering to individuals seeking more diverse options in their healthcare coverage. Within this category, preferred provider organizations stand out as the prime example, allowing participants the freedom to choose a healthcare provider without the necessity of referrals. This increased autonomy in selecting healthcare specialists and facilities makes PPOs an ideal choice for individuals who prioritize flexibility and prefer to have more control over their healthcare decisions. It actually does this by granting participants the ability to seek medical services from both in-network and out-of-network providers. PPOs enable individuals to access a wider variety of healthcare options, and it includes specialists and facilities that might not be part of their network. With a focus on empowering participants to make informed decisions about their health care, PPOs facilitate a seamless and accessible health care experience, ensuring that participants have the freedom to choose the specialists and facilities that best align with their specific medical needs and preferences. So this ability not only promotes a more personalized approach to healthcare, but also it fosters a sense of empowerment and autonomy in managing one's own health and well-being. So this is perfect if you prefer more freedom in selecting your specialists. Now there's the fee-for-service plans, or FFS, offering a greater variety of freedom in selecting healthcare providers. You're not tied down by referrals, but keep in mind they might come with a higher out-of-pocket cost. Then there are high deductible health plans, or the HDHP, that come with lower monthly premiums but often higher deductibles. They are often paired with health savings accounts, allowing you to save money for medical expenses tax-free. And if this doesn't spin you up, last but not least are consumer-driven health plans. They are called CDHPs, and they combine high premiums with health savings plans, health savings accounts, and they give you more control over your health care spending. These plans offer and often include employer contributions into your savings accounts. It's a great way to plan ahead for your healthcare needs. Wow. Now let's talk about the open season enrollment. The golden opportunity for federal employees to enroll in FEHB or switch plans. Remember, this window typically opens in mid-November to early December, so mark your calendar, folks, because this is a chance to make any necessary changes to your healthcare coverage. When it comes to understanding the nitty-gritty of your health coverage, it's essential to grasp the concept of health insurance contracts. Though the government does have full contracts and they negotiate between OPM and the health insurance carriers, and it isn't provided to the enrollees. Both parties are required to send each insured person a brochure containing vital plan information. Here's the key points to note. If you ever need to file a complaint related to your FEHB coverage, it should be filed directly against OPM, not the insurance provider. These complaints are typically handled in the appropriate U.S. federal district court. Oh, one more thing, folks. Health plans carriers do have the authority to garnish a federal employee's paycheck to collect unpaid deductibles and copays. So understand your plan's terms and conditions. It's actually crucial to avoid any unexpected financial surprises. Well, and there you have it. a comprehensive guide to the Federal Employee Health Benefits Program. Remember, knowledge is power, especially when it comes to your health coverage. You have to stay tuned for more insights and tips on navigating the world of federal benefits. I do thank you for watching. TBC has created a handbook. It is available to help you understand the complexities of your benefits, and it is available on Amazon for a fee or free by contacting us. If this video has helped you, press the like button, and also subscribing will help us. Pressing the chime will notify you of our new posts, and I do thank you for your service.